Okay, good afternoon, everyone. It is now noon, and we're going to go ahead and get started. I'm Helen Hockey, Executive Director here at the Pennsylvania Coalition for Oral Health, and we are so glad you have joined us today. We're happy to offer these webinars and brief updates on coalition work twice a year. We usually do it in June and December. And as always, this meeting is being recorded and will be shared on our YouTube channel. So you're able to share the link with others after today. And you can also view our older recordings there on the YouTube channel as well. So just some quick housekeeping as we get started. All lines have been muted by us. We are in webinar mode to keep background noise to a minimum. You are able to type any questions that you have into the Q&A box, which should be at the bottom of your screen at any time during the presentation. We may be able to grab them as they come in, but if not, we'll have a few minutes of Q&A time at the end. For those who may be joining by phone and who are unable to see the slides right now, I would just encourage you to go back and review the video at a later time. We always send the link for the presentation out directly to everyone who participates, as well as the slides by themselves as a PDF, because we do embed a ton of links to other resources and information directly into the slides. So you'll be able to click on those and learn more about some of the topics we're going to cover today. So for many of you, looking at our attendance list and registration list, it's not your first interaction with PCOH, but we do have a handful of new stakeholders on today's call. So I wanted to start by providing just a 10,000-foot view of some of our PCOH priorities. So thinking about our coalition, which is a statewide oral health coalition, one of about 40 across the United States, we focus on four main areas. We look at oral health workforce, which includes dental providers, as well as a lot of other folks that tend to get involved in helping to promote oral health as part of the workforce. We look at policy. So we do a lot of advocacy across the state to add oral health topics and focus areas into work that's currently happening. Sometimes that's, within a budget, sometimes that's in projects and programs, and we do try to infuse that oral health policy into as much as we can. We do a deeper dive into specific populations in a lot of instances. So when we talk about underserved groups, looking at low-income families, looking at people with disabilities, looking at rural residents. There's a lot of different groups that don't have the same access to oral health care in our state. So we want to make sure that we're focusing on that equity lens and bringing care to those who need it most. And then lastly, we were originally started way back when as a water fluoridation advocacy organization. So we continue to bring that into sort of the lens of where we're working, and we try to increase the number of water systems in our state that offer optimally fluoridated water in Pennsylvania. So nearly all of our work is collaborative. We do very little on our own, and we frequently work with other orgs around the state to accomplish our mission. So this is one of the reasons we have these webinars, and we want everyone to know the most recent updates from all of this work going on. So if you hear about something that interests you, just let us know. We would love your help. That can include just sharing our resources, checking in with a staff member of ours to let us know what you're working on, or actively joining a task force or a work group. And likewise, if you're working on a project in one of these areas and we can help you, definitely let us know. There are a lot of folks that we help with data resources, education resources, etc. So though we've been super busy in 2023, we're going to focus on just a few areas for the purposes of today's webinar. Each year, specific priorities tend to bubble up, and these 5 items that are listed on the screen were really sort of the bulk of the work over the last year. So this is not an all-inclusive list of the work that we did, but it's a great way to sort of get the conversation going and give you guys some highlights. But I really mean it when I say reach out, talk to us. We're always willing to have conversations about other pieces of the work as well. So, as I mentioned, one of the main reasons that PCOH was started, more than 10 years ago, was to advocate for water fluoridation in all communities in the state. So, we're going to start with talking about a little bit around fluoridation. At a time when we're really trying to focus on equity and getting people the resources that they need to live their best lives, water fluoridation is really the most important population health measure that we can incorporate for good oral health. Water fluoridation is a practice that's been used for actually almost 79 years. We're about a month away from the 79th birthday, and there's thousands of studies on it. So, in fact, it's one of the most heavily researched health interventions, really in history. And I've been actually, I have to add a little aside here. There have been a lot of talks on social media channels lately because apparently Joe Rogan is talking against fluoride and the world is taking his word for things. So it's a priority for us that, we want to make sure we're battling any misinformation out there. And making sure people realize that every major public health and medical organization supports the benefits and the safety of fluoride in preventing tooth decay. So it's really effective, and really for one main reason: it reaches everyone in a community. So regardless of income, insurance, ability to get to a dentist or dental provider, you can have access to fluoride in the tap water. And we've had some really great discoveries in things like fluoridated toothpaste and preventive dentistry. But those things don't always reach every person in a community, especially our most underserved individuals. So we really view community water fluoridation as an equitable way to reach a whole population of individuals and families. So one of the first projects around fluoride that we worked on in 2023, in conjunction with Wakefield Research and the American Fluoridation Society, was we conducted a market research study and measured a sample of Pennsylvanians to basically find out their general thoughts and opinions on water fluoridation. So as you can see by the numbers on the screen here, most of our Pennsylvanians support community water fluoridation. One item of concern, however, was the number of people who don't realize where the decision to fluoridate or not is made. Nearly 3 out of 5 people surveyed thought that it was a state or a federal level decision. Nothing could be further from the truth, and we think it's pretty important that people know that. We have over 1,900 water systems in Pennsylvania, and every single one of them is able to make their own decision about fluoridation. So sometimes that's through an elected advisory board, sometimes it's an appointed water board, but every community has the right to decide for themselves, which in our minds gives everybody a lot of power. So you can help advocate for your board making the right decision. And, as you can also see, we saw the majority of residents support fluoridation, but we have 20% of them that are somewhat undecided. So to us, this shows potential for a lot of education and health literacy that could be shared around the benefits of water fluoridation. A second project that we implemented this year was our water operator campaign. We consider water operators, and you've probably heard me say this before, but we really consider them the unsung heroes for oral health. If you think about it, water systems prevent way more dental disease and help people stay cavity free, even more than a dentist in a community does. And so often these individuals and the organizations, the water systems, are never really reached out to unless there's a major problem with the water. And then they hear a lot of complaints. So we wanted to take an opportunity to say thank you to our community water operators. If you have a community group like a Rotary Club or a Girl Scout troop and would like to request one of our thank you packets, please just reach out using the link on the slides. And again, those will be sent as a PDF and be clickable later. And you'll be able to kind of join this movement to make sure that we're recognizing our water operators. We also maintain a fluoride resource page, which includes a map of all the water systems in Pennsylvania and tells you which ones are fluoridated. So we completed that a few years ago, and we've had almost 2,000 hits on the map just this year. And our fluoride resource page, which is actually broken down by audience, has had more than 8,000 views. So, we really believe that it's important to share this information with as many people as possible. And one of the other steps we took towards that is we did one other administrative task this year, which was to update all 1,900 water systems in the CDC's WAFERS database, which is the water fluoridation reporting system. And that's what populates the public page that's called My Water's Fluoride. And that's a great resource for professionals and consumers. It hadn't been updated for the state in about 10 years. So it is now up to date and can be used and referred to your patients, to your friends, your colleagues, so that we have some up-to-date information on fluoridation status. So that's something that we're really proud of, that we were able to accomplish. We were all happy to work, as always, with Pennsylvania Department of Health and their oral health program on an ongoing project to offer grants directly to water systems who want to start optimally fluoridating their water, or who may already do that, but they need money to replace aging equipment. So in 2023, we were able to award 2 grants to water systems that are currently fluoridating, Western Berks and Wilkinsburg Penn Joint. If you are in a non-fluoridated area and you want to share this info with your water system, we actually have a grant period that is open right now with up to $50,000 in available funding for systems who want to start offering their customers optimally fluoridated water. We will also entertain grant applications for any systems that may need to update equipment as well. And then the last thing I wanted to mention here is that we regularly attend State Water Association meetings, really to help build relationships and offer resources to the decision makers around water. We're currently working towards getting the CDC's fluoride course approved for water operator continuing education credits, working with the Pennsylvania Department of Environmental Protection. And we hope to finish that up in the first quarter of 2024. So it really gives a nice way for water operators to get a small reward for learning about fluoridation. And then another important aspect of our relationships with water systems include recognizing the systems who've consistently supported their communities with fluoridated water. So the American Dental Association, CDC, and the Association of State and Territorial Dental Directors do a recognition process annually where they recognize systems who have been doing water fluoridation for a long time, or who've had threats to their water systems and have rebounded and reaffirmed their dedication to water fluoridation. So I just wanted to share this slide with everyone so that you could see if you happen to live in one of the areas where this is your water system, please reach out and tell them congratulations. Let them know that you're proud that they were recognized. We're extremely proud of 7 water systems who hit 50 years of fluoridation just in the last 2 years. And we'll be recognizing our 2023 awardees sometime in the spring is usually when those awards come out. So stay tuned. The last piece around fluoride I wanted to touch on, we're hoping to have a lot more detailed information available in January, but wanted to let everyone know to mark their calendars now. Speaking of many, many years of water fluoridation, Philadelphia is actually going to be hitting 70 years of continually fluoridating their water in 2024. So we're hosting a celebration event at the University of Pennsylvania on May 1st, which will recognize the Philadelphia Water Department. And so very super excited about that. There's going to be a lot more information coming out, but if it's something that interests you or you're local to that area, you may just want to mark your calendar now. The next subject we're going to do a quick update on is our Medicaid advocacy work. With almost 3 million people who rely on Medicaid for their health care in the state, it's pretty important to us that there's adequate access to dental care and dental providers. Back in 2011, due to budget cuts, of course, a lot of you know that the state changed our adult program of dental benefits and essentially removed treatment options for things like root canals, gum disease treatment, crowns. On paper, these benefits are still listed as covered, but there's an approval system in place called the benefit limit exception, which really isn't working because it's very rarely approved. Historically, about 99% of those who apply for that benefit do not get it. And so, even though on paper we say these benefits are covered, in reality, they're really not covered services. So that continues to be a main focus area within Medicaid advocacy. So one of the things that, why we think this is so important and why we really want to open up those conversations around Medicaid is that, our state uses managed care organizations, MCOs, to work through, providing these benefits to people enrolled in Medicaid. So we kind of try to dig in and learn more about that process. And one of the things that we look at is network adequacy. So, different health plans are committed to having enough providers to meet the needs of the people they're serving. And it's actually a state law that insurance companies have to have enough providers. So that's part of our advocacy work, is making sure we have adequate networks. Currently, right now, looking at our 2021 licensure data, we know that less than 1 in 4 of our general dentists are accepting Medicaid, and only about 1 in 7 are billing more than $10,000 a year to Medicaid. So we would call those folks to be meaningful providers. And we think, adult care is really important, not just because it gets the care to adults, but also because it becomes a family issue. When an adult who has Medicaid doesn't go to the dentist on a regular basis, and we know 80% of them don't, it means that kids are less likely to actually go. It's a lot easier when you're making it a family affair to get everybody in for appointments and to keep that relationship going. So in order to improve access for kids, we also want to see adults get better care. So in addition to our pretty constant advocacy to restore the adult dental benefit, we also wanted to report on some pretty great changes that have happened over the last year or so in our state's Medicaid program. The Department of Human Services released 2 bulletin updates in the last year or so, which added clarification about the use of teledentistry, which, we have codes that are covered by Medicaid, and added new codes for things like nutritional counseling and oral hygiene instruction, and even added the gum disease code D4346. So if you're a dental provider, that's a big deal, and a lot of patients, need that code. Our goal, of course, is to be able to spread the word to dental providers about why participating in Medicaid is so important. And we're actually going to be working on, in 2024, some advocacy work to spread that information out to providers who haven't, typically been billing to Medicaid, to make sure that they're aware the benefits of participating. So I also wanted to mention, we're still waiting for the Senate. If you guys know much about the legislation process, the Senate still hasn't passed our fiscal code for the July 1, 2023 budget. But the current version of the bill that's sitting in the Senate right now includes an increase in specific codes of dental services. It's actually an increase right now that's listed at $24 million, which would be a pretty significant increase. We're not sure, of course, if this piece is going to make it through to final passage, but it's really nice to see dental services being recognized. So, and the other piece we wanted to mention is that the Office of Medical Assistance Programs was able to report this year that they were caught up completely on all Medicaid provider applications that were backlogged. So that's a huge accomplishment. That means that, we don't have providers waiting to get a number from the state to provide care. Now, there's still some of the managed care organizations that then have to credential each provider that have some backlogs. So, we're still hearing that there is some waiting time for final, approvals with that. But the good news is we're seeing progress, and I know the MCOs are really dedicated to making sure they move these things faster. So kind of we're not 100% perfect yet, but we're getting there and we're doing much better. So just a couple last, few other updates before we move on from our advocacy work. Probably some of you have heard about the Legislative Budget and Finance Committee study, which was published in January. Seems like it was years ago, but it was this year. And we are kind of using that as a guide for some of the work that we are doing in our advocacy. So, check out that study if you haven't read it. It talks a lot about dental access in the state and gives you a lot of great data. So if you're someone who works in the oral health field and you're looking for grants to do some of your work, there's some great data in there that you can quote to show need. We've done a ton of, in-person advocacy this year. So some of our PCOH staff were able to travel to Washington, D.C. and do federal advocacy for dental care for veterans, which was pretty rewarding and really amazing to see. We also held a state oral health advocacy day in Harrisburg in April and had a ton of meetings. I think it was over 40 advocates came out. We were able to go around and visit with legislators and staff, talk about the importance of dental care, and really establish some new great relationships. And then the last section of this slide simply lists some of the dental bills that are sitting within the legislature right now. So again, you can click on the links, you can read the full language of the bill. We do have the titles of the bills there just for reference, but the one personally I have to say that we're most excited about is the first one, which is a bill that would restore the comprehensive dental benefits for adults in the state. And, we're hearing a lot of great things from the Department of Human Services that they're interested in this as well. We'll see where that kind of leads to, but it has been voted on. The House bill has been voted on the House floor already, and it's waiting to come back for third consideration. We had a companion bill come up in the Senate, which, used the same language. So we basically have bills running at the same time in the House and the Senate to restore those adult dental benefits. Definitely the closest we've been in a decade to doing it. So super excited for that and hoping to see some progress there. If anyone on the call wants to reach out and reference either, if you reach out to your local rep, you can reference the House bill number. If you reach out to your local senator, reference the Senate bill number and just let them know that you're supportive of this and why dental benefits are so important in your community. We would love that support. It's a great thing to do and will really help us get this to the finish line. We also, I briefly mentioned a little bit around teledentistry. Teledentistry is not defined in Pennsylvania. So there is a bill introduced by Chairman Frankel that would actually codify and write into the regulations what teledentistry is. So we're, again, excited about that one, hoping that it moves. It's already gone through a few considerations in the House. So that's pretty exciting. And then one that, we hear a little bit about is, the discussion around interstate licensure and, how we can more expediently allow providers to practice in Pennsylvania if they come from another state. So there's a dentist and dental hygienist licensure compact bill that was introduced in both the House and the Senate that really focuses, it was developed by the Department of Defense for military families. And we're going to talk a little bit more about that with the workforce piece, but just some information if you want to read the bill and see what it's about. It's been pretty quiet so far with that bill, so we're kind of just keeping an eye on it. And the last bill I wanted to mention, which was really kind of stemmed from a lot of work from our State Dental Hygiene Association, was House Bill 1478, which, many of you are aware of the required dental screenings that have to happen in certain grade levels in schools in Pennsylvania. And right now, dentists can do that screening and certified school dental hygienists can do the screening as well. This bill would simply allow for districts that don't have a dental hygienist as an employee that they would be able to have public health hygienists come in and do the screenings for the kids. Many school districts are reporting they're having trouble finding local dentists who are able to take the time to come do it. So it's a little bit of an access to care issue. And we've heard from our federally qualified health centers that they would love to be able to utilize their public health hygienists instead of their dentists' chair time to complete these screenings. So that one has made it the whole way through the House, is sitting on the Senate Education Committee right now. So that one I would say is the most the furthest along. So keep an eye on that, and we're hoping to see some updates in 2024 for that. So with that, I want to talk a minute about workforce, because I touched on a couple different things. And, for some of you, these facts aren't going to be a lot of new information, but it's a great summary of some of the key issues that we're running into. So we know in our state, dental providers, we may have enough providers on paper, and even that's getting a little stretched. But what we have is a kind of a disproportionate geographic distribution of providers. So we have more providers in urban and suburban areas, even as a population ratio, and less in the rural areas. So that means that we see more access issues in rural. And of course, the federal government tracks all of that through the Health Resources and Services Administration. And they actually designate specific areas as health professional shortage areas. In Pennsylvania, we've got 161 of those, and about almost 2 million people that live in those areas. So a lot of people who don't have access to a dentist. And in order to be a dental health professional shortage area, you have to have less than one dentist per 5,000 people, which that's pretty significant. So there's probably a lot more that are close to that ratio, but maybe haven't hit that threshold yet. When we've done some analysis in the past, we worked with the ADA's Health Policy Institute. We discovered that we're expected to continue seeing a decline in the number of dentists in the state. We will expect to see that for the next 7 years or so. By 2035, we'll kind of, bottom out and start to come back up. One of the things that I like to mention when we talk about this is that the 2021 licensure report, which, every dental provider fills out when they renew their license, we actually saw an indication that more than 30% of the dentists who currently have a Pennsylvania license are planning to retire in the next 5 years. So 30%, that's a lot, especially when we have about 7,500 practicing dentists in the state. It is possible that we could lose a third of those within the next 5 years. So definitely something we're watching very carefully. We need to increase our workforce. And what we're seeing sort of as a result of this declining workforce is that patients are now waiting longer. We did a secret shopper survey in last year. I'm sure many of you have seen the report from that. We're not going to get too into that. But we have an average of about 55 days right now in the state for a new patient visit. Compared to pre-pandemic times, we had some reports that quoted anywhere from 7 to 14 days as an average wait. So 55 days is significantly longer. And when we look at places like federally qualified health centers or health centers that would serve our more underserved populations, we see that number can double pretty quickly. So people are waiting 3 to 4 months for that first appointment. We've got, 3 dental schools, full-time dental schools in the state. We've got LECOM up in Erie, and we've got 13 hygiene programs in Pennsylvania. So, we're putting out, 300 dental grads and 300 dental hygiene grads every year. But to replace 2,500 dentists over 5 years, it's just simply not enough. So we're trying to think creatively about that, and to really look at not just we can't solve the problem on a state level, but what can we do maybe regionally that would help? So with that, I mentioned some of the reports that we've had come out around workforce. Our State Department of Health Oral Health Program was able to put out a really great report, of course, linked on the slide here, that used some of the 2021 licensure data that I talked about. So definitely check that out. And then we were able to create a workforce dashboard on our website that will be continuously updated, hopefully. And as soon as we have some of the 2022, 2023 data, we'll get that updated for everyone. But it really breaks down the area sort of at a county level and state level, not just the number of dental providers that are in that area, but also the number of Medicaid providers too. So that dashboard hopefully is helpful to you. And, if you're in an area that serves a broader region and you want to say, okay, well, which county is doing the worst? Which county is doing the best? This is a great way to do that. So I hope you can find some uses for it and give us feedback if there's anything that comes to mind or that you would like to see promoted there. We're also looking bigger than, of course, just dentists, hygienists, and specialists, looking at our dental assistant population as well, ways that we can improve that process, maybe even ways that we can add more dental assisting programs, through high school tech groups, our VOTEC programs. We've got 22 VOTEC programs with dental assisting in the state. We'd love to see that number go way up. Because it'd be great to grab some of these high school students and get them into dental careers early on. So that's something that we're focusing on and will continue to do into 2024. And then we're very fortunate to have some funding through the Department of Health Oral Health Program and a grant that they have through HRSA to convene a small group, sort of what we call our think tank or our community of practice, made up of the state organizations that you see there, to really kind of dive into what's happening in the state, to come up with ideas and promote ways that we can start to make some solutions. We're not sort of in dire straits yet, but we want to make sure that, it takes a long time to make a dentist and it takes a long time to make a dental hygienist. So we want to make sure that we're starting now in driving people into these dental careers and hopefully driving up our workforce numbers. So those are some of the projects that we were working on. The last piece I just wanted to mention with workforce is, of course, we enjoy a lot of partnerships with other groups that we consider part of the workforce, even though they may not typically be considered dental. Our certified community health workers, they really, if you haven't worked with community health workers, it's a wonderful group. And those folks serve as direct connectors between community members and health services and health workforce. So we've really concentrated a lot of our efforts in making sure that our community health workers feel supported in their work. We've got Con Ed classes, resources, doing presentations, exhibiting, and we were able to even get an oral health course certified through the PA certification board so that they can get continuing education credits for learning about oral health. So some really exciting stuff there. And we want to make sure, the one thing I point out, especially when we talk to medical folks, is, dental disease is preventable, right? Largely preventable. And so you can't discount the role that education plays and health literacy plays in preventing disease. So you don't have to be someone who can pick up a drill or a scaler to be able to make a real difference in the community. So utilizing our community health workers, hopefully, then helps to prevent that need for the dental workforce later on. If we can cut down on the disease burden, we then don't have to worry so much about the workforce declining. So just something to keep in mind and ways that you can do that within your own communities. If we can help, we're glad to. We do work a lot with the medical provider community and support a lot of projects that help to educate them about oral health issues. I did want to just mention I threw silver diamine fluoride on there. Many of you might be familiar with the use of silver diamine fluoride to arrest and prevent tooth decay. It's a pretty relatively new medicament in the US. But beginning next month, medical providers are going to be able to use it in their offices, code for it, if they choose to. There's, of course, going to be a formal training process, and payment mechanisms have not been finalized. But I would expect that because we're hearing so many medical providers say, hey, I made a dental referral and my patient couldn't find anybody to see, that we may start to see silver diamine fluoride in the medical office being picked up as something we see more of in 2024. So that's just more of a little, sneak peek of what might be out there. So now, as we move into the connections portion of our report out, I just wanted to first mention our state oral health plan. And those of you who have been around a while, you know, we talk about this a lot because it's pretty important. We work as a contractor with the state, and we help the Department of Health implement the plan. And we absolutely love to share information, you know, around all of this so that we can create connections with our stakeholders. Obviously, I'm not reading through all the purposes of a state oral health plan that are listed on the slide. You can review it later if you'd like. And if you actually click on the graphic of the plan, you'll be able to link directly to the plan and check it out. So if you haven't read through it, it's probably a good idea. It's a short document for a 10-year plan, and has a lot of great information. So when, you know, I wanted to show just a few of the measures and the outcomes, you know, from the plan and some of the success that we've had in the first 3 years. So there are actually 22 measurable outcomes, you know, data that we're tracking and measuring over time. And we have 10-year goals that are set for each of those 22 measurable outcomes. And so this is just 3 of them that we've seen some progress on in just since 2020 and thought it was pretty cool. You know, a small decrease in adults that have tooth loss, right? That means disease burden's going down. We've seen an increase in the number of schools that have school-based sealant programs, which is super exciting because, again, we know prevention is the best way to get rid of that disease. And a very, very small increase in the number of general dentists who are willing to accept Medicaid. Now, it's kind of silly to report out a 0.5% increase, but what I will say is that looking back on the numbers over the last 10 years, we were stuck. We were literally stuck at 23% of general dentists accepting Medicaid. And this past year, this past licensure renewal period was the very first time we've seen any movement. And so, yes, it's only a 0.5%, but we take it pretty seriously, and we're glad. We hope that all dental providers would consider accepting Medicaid, and it doesn't need to be 60% of your practice. It doesn't even need to be 10% of your practice. It can just be that you agree to see 10 families and just help, because we'd love to see every provider stepping up to help some of these folks that really need it. So that's something we're tracking. We're pretty excited about it. And on the next slide, we're going to do a little bit more detail about how we're working to kind of complete these plan goals. So we at first added a new section, you know, to the website, which is that workforce data dashboard I already spoke about. You can see the link right there. Please definitely check it out. We continue to work with the Department of Health to offer mini grants to smaller community orgs that are doing sort of the work of the plan. We open up a grant cycle every August and basically ask folks to just identify the program that they're promoting and how it relates to the state oral health plan. So it's been really great to see those mini grants go out every year. And then the last thing, again, which we have talked so much about this year, but it really makes us excited, is that we finally have a baseline to report for the percentage of kids in the state having experienced cavities, which, you know, again, sounds very simple, but for years and years and years, we really didn't have any data that show how many kids have cavities. So, you know, again, utilizing funds through the Department of Health, we were able to help them conduct a basic screening survey, which is a nationally recognized tool to measure decay rates in kids. So it focuses on 3rd graders, but that's sort of like the representative sample. And what we can tell you, and there's more information about that, of course, on the link, is that we found 60% of 3rd graders in the state had some cavity experience. And so that's a pretty significant number. We know that that disease is pretty widespread then. And it gives us something now to have as a baseline so we can measure progress against. In 5 years, we want to do another basic screening survey, and we will actually be able to measure whether we've made a difference in the percentage of kids having cavities. So pretty exciting stuff, especially if you love data like I do. Now, as a little bit of a continuation of our connections topic here today, wanted to just share some places we visited in 2023, some of the places, because the reason we'd like to share this with you all is that you may know of other groups or organizations that we haven't connected with. And, we're kind of always happy to make those connections and do what we can to work with more stakeholders. It's obviously, I'm not going to read through all of these, but we've done a lot of work within some of the dental schools, the dental hygiene programs. I mentioned our state water conferences, which are really, really important, and trying to do as many community events as we can. Sometimes those are career events. We've done immunization conferences, groups that are centered around medical homes. And we were even able to do an advocacy event in Perry County, which was great and sort of helped us to, train some oral health advocates. So people who can work in their own communities to kind of spread the word. We also really enjoyed going to our first remote area medical or RAM clinics. If you're familiar with the Mission of Mercy model, RAM clinics are very similar in that they exist as pop-up or 1-day or 2-day events, but they're typically hosted in more rural areas. So it was great to volunteer at these events, and we tried to sort of share some of our resources to help connect people to permanent care. The free clinics that are pop-ups are great for, patching some of the holes in the system. But ideally, we want to see people being able to have a provider that's their dental home. So that's sort of a few of the places that we were visiting this year. And wanted to share information, speaking of free clinics, about a new report that we just added to our website last week. As part of the dental safety net in the state, we really recognize that free and charitable clinics are a great option for getting care to uninsured and underinsured people. We've been tracking these data from some of these clinics really for the last 5 years. And Allison here at PCOH was able to compile all of the data we've collected into a single report. And I highly encourage you to check it out. We've got some pretty valuable resources in some of our communities, and not so similar to the RAM and the Mission of Mercy events. We have a lot of free clinics that operate, 24/7, 365. And they do serve as a dental home for folks who really don't have other options. So some really good information in that report. And pretty crazy to imagine that in 5 years, that we've had $27 million of dental services donated to people in need, which, I think is good and bad, depending on how you want to look at that. So as we wrap up the connections piece, I wanted to mention, we continue to make other small efforts. We talked a little bit about some of our bigger programming models, but we try to bring that oral health lens to other health topics. So we've got resources available through the website on tobacco nicotine cessation, HPV prevention, school-based healthcare. We are hoping to start more work. Actually, one of our staff is at the School Counselor Association meeting today to really talk to the folks that might have some input into, again, those high school students who are seeking career options. Let's make sure we're talking about dental. Let's make sure that, we've developed some amazing, health literacy pieces on things like sugar sweetened beverages. Well, let's make sure our certified school nurses have access to those. So those are connections that we're trying to build really kind of in a lot of different small spaces, but they are connections that we're excited to make and hope that you'll join us in. Now, I'm not going to go through all of these numbers, but I wanted to just demonstrate our overall reach through the state. Kind of who we talk to, how many people are involved in the work that we do, and how important that is that we continue to grow these numbers. I did want to say what we're especially proud of, is the second number and the last number. And so talking about oral health materials requested and talking about resources that have been downloaded. We started about 1.5 years ago, maybe 2 years ago, a page on our website. You can get to it if you go to the website, right in the menu, it says request materials. And we wanted to give a place where people could get resources that they might not otherwise have access to. I can tell you as you know, someone who used to work clinically, there were times you wanted to print, 100 copies of something to share with patients, but you couldn't always do that. And so this is a great site and a great resource for people. If you're going to attend a local health fair and you want to grab some of our sugar sweetened beverage materials, you can go to the request materials page and request them. Everything's free of charge and grant funded and or covered by donors. So it's a great resource. And as you can see, it's being heavily used. Thousands of materials have gone out, thousands of downloads. So it makes us really happy. Because a coalition of 5 staff cannot reach everyone in the state, but with working with all of our stakeholders and all of you, we have a much better chance to expand that reach. So before we get to our summit, I just wanted to briefly mention the work groups that are active this year and who we're working with. I talked a little bit about, our Medicaid adult dental work, and we've got an amazing group of organizations from across the state who are really hyper-focused on this and help us in our advocacy efforts. We've got a water fluoridation task force and sort of what I would call a speakers bureau, but some folks who are dedicated to, being a spokesperson for water fluoridation in their communities. We're always looking for more and more people. So, when we hear rumors or we see that fluoride comes up on an agenda, we want to be able to have somebody from that community go to a meeting and talk about how important it is. So, we offer resources and support, and we would gladly have anybody else help us in those efforts if you're interested. We do have a group that's been around for many years, our Family Oral Health Collective Task Force, which focuses a lot on prenatal and pediatric oral health. And then, of course, our Workforce Task Force, which is our smaller community of practice group that meets regularly, but also includes a lot of the groups who join us for different meetings and events. So, groups like our State Dental Association, Dental Hygiene Association, Dental Assistants Association, dental schools, dental hygiene programs, and the list goes on and on. But we really feel like those folks are a big part of looking at our workforce and getting some information out there. So definitely, if you want to be having those conversations, let us know. And then lastly, part of our work with the Department of Health is we maintain a school sealant program task force, which is made up of the programs who participate in the Department of Health program. Just in the last school year, there were over 6,000 sealants placed, in almost 100 different schools across the state. So some really great folks doing some really great work there. Now, the last thing we're just going to touch on today is our State Oral Health Summit. We hold a large statewide conference every other year. We just held our 4th one a few weeks ago, and I know many of you on the call were there, so we're not going to go into too much detail. But our theme this year was, paving the road to equity and really looking at the needs of specific populations and how we can meet those needs. So you can see some of the numbers there. We had some really great attendance. It was so wonderful to see so much passion in the room. We're going to be finalizing all of our pictures and videos and recordings from that event. There is a page on our website for the summit. You'll be able to view everything there. So if you had to miss it this year, you'll be able to check it out and hopefully watch a couple of those recordings and learn some new things. So I wanted to show just a quick brief list of some of the topics that we covered at the summit, so that you all can see it was a pretty broad space, and maybe if you weren't able to attend or join us, that you can check out some of the resources we'll be adding over the next month or two, that will be available for anyone who wants to check them out. So our next summit will probably 99% probably be held in November of 2025. So that's still a ways away. But stay tuned. We'll be giving some more information after the first of the year on that. It's always a really great event. And I can't tell you how exciting it is just to be in that room with so many people who are passionate about oral health. So It's super heartwarming. So if you are newer to the coalition, just wanted to share a couple ways that you can connect with us. Many of you know we do a newsletter every week, a short, brief newsletter. It only takes a few minutes to look through, but we also do a lot on social media and try to make connections there as well. So if you're only following us in one of these ways, you may want to consider the others. We try to post different information on different sites. But a lot of great ways to connect, and we share a lot of resources that way as well. And then, wanted to mention some of our upcoming 2024 events. I mentioned a little bit around the conversations happening in the Dentist and Dental Hygienist Licensure Compact. We're planning a session, an online webinar session, where we're going to bring in some different examples of interstate licensure compacts and agreements, so that people who are interested can learn more. So we're just finalizing that date with some of our presenters and should have it in the next week or two for everybody. So stay tuned. And then I mentioned our water fluoridation event in Philadelphia. And again, our two webinar updates are listed there as well. So similar to this model where we just give you a little bit of information on the work we're doing. So that's what we've got sort of already on the agenda. I did happen to look at the conferences that we're planning to attend or exhibit or present at in 2024, and I added them up this morning, and right now it's sitting at 44 conferences. Which is a little scary, but there are places where you'll be able to see us, work with us, and if you have places where you think we should be, definitely let us know. Now, we went through a super high level of our work this year, and of course, sometimes we do this at the beginning, but I really wanted to, talk about the work and then recognize how fortunate we are to have so much support from our corporate and community funders. We are a registered 501c3 nonprofit charity in the state. And in 2022, 84% of our funds went directly to programs. So we're really trying to do a lot of good with our funds. And it's so wonderful to have these great supporters for the work. So we rely on these guys to kind of keep us moving in between grants and federal grants. And a lot of our funders have been giving for years and years. So just thank you guys so much. We also have a great list of individual donors, random people that just choose to support us. And we're just so grateful for that. There's a lot of different charities you can give your money to. And it's great to see so many people support us. So, on behalf of the board and all the staff here, just thank you, thank you, thank you. If you want to learn more information or folks that might be interested in sponsoring our work, let us know, and we're happy to have those conversations at any time. So with that, I'm going to pop over to our Q&A and see where we are at with that. I know sometimes we get more comments and things, but definitely let's see here what we've got. We have some questions about effectiveness of nurses applying fluoride varnish and silver-diamine when indicated. I will say that in Pennsylvania right now, if you're not super familiar with the process, we did just recently work with the Department of Education and the Department of Health on changing the dental health program guidelines for schools. So it used to be that there was a lot of recommendation around fluoride supplements and mouth rinses, which we know are not as effective. And, thanks to Dr. McDaniel's leadership at DOH, we were able to add fluoride varnish as the preferred method for schools to use in their dental health programs. So I think we are going to start seeing that more and more. I don't know, it's probably, we got to wait for the general medical community to pick up on silver-diamine first. But then, we may start to see that more. And where we could make some efforts is in the 27 districts that have certified school dental hygienists, because they would be able to apply SDF right in schools. So definitely really exciting that we will start to hopefully see that moving very soon. And yes, absolutely. We had so much good, it seems like the silver diamine was the topic of choice here. So a couple questions on that, and really looking at sort of what's happening with that. The one thing I will say with silver diamine in schools is that it is harder for the consent piece, because we know that the medicament stains the teeth. It's a little scarier to do that without a parent looking you in the eye and telling you, yes, I understand that the tooth will turn really dark and I'm okay with that. So that is one of the things that we hear about. So I know Dr. Thielen mentioned that in the questions here. We also have to make sure that providers are aware. It's hard to believe there are dental providers out there that don't know about silver diamine fluoride. There are probably a decent amount of medical providers who don't. And so it's possible that if a tooth is treated not at a provider office, that the provider may not realize it, and may just see the stain and assume that there's a bigger decay problem there. So it's something that we've got to work on. We've got to make sure that our communications with families are really clear. And that if this treatment is done in a school setting or in a place where there might not be a connection to the medical or dental home, that we send follow-up communication, both to the families and to the provider. How wonderful if a school nurse was going to apply something like this, that they would also then send a letter to the physician and to the dentist to say, hey, this is what we did today. So I think that's going to have to be a part of the conversation as we start to see these things being used more and more and more. So any other questions or follow up to any of that? I know we're down to just about a minute or two left, but wanted to make sure. And you, of course, are always able to follow up with us directly if there are things you have questions on or you want to learn more about the work that's happening. Really, really interesting. And Dawn, I'm going to mention your comment here that, we do have a certified school dental hygienist who is applying SDF in the schools, and she's able to get consents, and she does before and after photos, and she's had no backlash from the families. So that's pretty darn amazing. And, we may be using Donna as a model as more and more schools become interested in this type of process. And I didn't talk a ton about school-based health centers, but we do have a few dozen in the state where there's an actual health center located within a school. And I would expect we'll start to see things like silver diamine fluoride used in those more and more. And we may need to start establishing some of these models to follow. So very, very cool. All right, I'm not seeing any other questions come in. So I think with that, we will wrap up for today. I hope that you all have an amazing rest of the month and a great holiday season. So hopefully you get some time off. I know everybody's working really, really hard right now. And we are really hopeful to connect with all of you in 2024 as well. So thanks a lot and have a great day, everyone.